Audio recording for this meeting has begun.
Welcome everybody to an NCSD and CDC sponsored webinar on resources for forecasting and monitoring Bicillin Inventory. Thank you for joining us, whether it's good morning or good afternoon, wherever you're at, and we appreciate everybody's patience. I know it's late in the day, but we also wanted to make sure that this webinar was available for our colleagues on the West Coast and potentially the Pacific Islands. Just a couple things about the screen that you're looking at. If you need to get our attention, you'll see a little person at the top of the screen, sort of with their hand raised. Just use that drop-down arrow, and if you need to get a hold of us, hit the raised hand function, and we can see that you need to talk to us, and we'll send you a chat message. Throughout the webinar, you can download a copy of the slides and the tool that we're going to discuss by using that select file, highlight the file and download it. And so with that, let's go ahead and begin. So my name is Charlie Ravens. I'm a capacity building and technical assistant consultant with the National Coalition of STD Directors. I was formerly the STD director for the state of Illinois for a number of years. And excited about this webinar. We've been working on this Bicillin issue for quite a while, and I'm going to turn it over to my colleague, Dr. Roxanne Barrow at CDC, to introduce herself.
Hey, thank you, Charlie. Hello, everyone. Again, my name is Roxanne Barrow. I'm a medical epidemiologist in the Program Development and Quality Improvement Branch in the Division of STD Prevention at CDC. I serve as a liaison to the FDA and work with their drug shortage staff to address any STD drug availability issues. I worked with Charlie on the NCSD Bicillin project, which he'll describe shortly. On behalf of the Division of STD Prevention, I would also like to add my welcome to you all and thank you for joining the webinar today. I'll turn it over to Barb.
I think Barb is muted, so I think, Susan, if you want to say a few words.
Hi, good afternoon. I'm Susan Hughes. I'm actually a contractor with Northrop Grumman. I work for Barbara Nichols, and Barbara Nichols is a project lead at the CDC Center for Surveillance, Epidemiology, and Laboratory Services on a program called Countermeasure Tracking Systems, and we'll be talking about IMATS later in the presentation.
Thank you, Susan. We did have a little technical glitch where Barbara's on the phone, but her phone's currently muted. So we may unmute the phones a little bit later if we get the chance. So let's get started. A few housekeeping things. Because we have a lot of people on the phone right now, we have over 70 people on the phone. We've had to mute the lines. I'm sure all of you have been on webinars where it just takes one person who's making noise on the other end and becomes very disruptive. So there may be times we will open up the phone lines for discussion. We would just recommend that everybody mute your own phones if you're not speaking, and then if you want to speak, raise your hand and let us know, and then we might be able to try to unmute the phones. If you do have questions for the presenters, feel free to use that chat window that says question for presenters. It's on the right-hand side of the slides, and we will try to get to your questions. If we can't, we may get to them later on at the end of the webinar. We are using technology, and every time you use technology, you know that sometimes it works and sometimes it doesn't. If for some reason we lose internet or phone connection, just stay on the line, and then one of the presenters will try to get back on the system. So it might just take us a couple of minutes. So just hang in with us. But I think hopefully if the technology gods are with us today, we should be okay. Again, as I've said, you can download a copy of the slides and the tools and the instructions that we're going to be talking about by using this window. We will also make those available on the NCSD website probably within the next week. So it's not going to be up there in the next day or so, but early next week they should be up there. So the first thing we like to do is just a quick poll question, get a feel for where people are at. So if you could tell us what type of agency you're currently located at. So even if you're a CDC employee and you're working in Ohio, then you put, a state or local health department. So let's just get a quick feel for where our webinar participants are from. And we'll give it about 10 more seconds. Okay, and we'll end the poll. So it looks like almost 3/4 of you are at state or local health departments, which is great because that's our intended audience. So we're really glad, again, that you're able to attend this webinar. We hope that a lot of the information will be helpful to you in your program. So quick walk through the agenda. We're doing the welcome and introductions. I'm going to do a quick overview of our forecasting and inventory monitoring project that we've been working on. Talk about the results from a survey that we did of project areas on Bicillin. Roxanne's going to talk about what's the current state of Bicillin availability. I'm going to go through a tool that CDC and NCSD developed to help programs estimate what their Bicillin needs are. And then our colleagues in C-Cells are going to talk about a tool that they developed for emergency management that might be adaptable for some STD programs, and then we'll open it up for discussion and questions. So as you can see, we have a lot of information to go through, and let's go from there. Again, if you have any questions, if we're going too fast or too slow, feel free to use that raised hand icon at the top of the screen. So the first question is, why is it important to forecast Bicillin and monitor it? I think most people know that, we're in the midst of a current increase, probably outbreak of syphilis again in this country. And so it's really important to ensure that we have adequate supplies to be able to prevent and control syphilis. If we don't have treatment, then it's, the situation would even get worse. It's also important to know how much Bicillin you need in order to sort of budget how much money you need to be able to spend on and procure on Bicillin. And then thirdly, it's important to be able to track, how much Bicillin you have on hand and location, because if you get an outbreak or maybe there's an adjoining state or jurisdiction that needs Bicillin, perhaps if you know where your Bicillin's stockpiled at, you might be able to lend some to another jurisdiction until they can catch up. So those are really important reasons. And then the last and final reason is that in the current CDC request for applications called PEACH, there are some requirements around Bicillin monitoring. And so as I mentioned, those are in the requirements. Primarily, programs need to be able to implement a Bicillin forecasting inventory system to monitor their supplies, as well as to have a plan to address shortage in their area. So hopefully some of the information we'll be providing you today will help you as you either write your application or in the future as far as getting prepared to either monitor or forecast your needs. So CDC and NCSD have been working together for about the last year on really two main projects. One was to develop a tool that programs could use to forecast how much Bicillin they need to be able to procure it, to make sure it's on hand to address the outbreak and make sure there's enough to meet your current needs. And then secondly, identify some available tools that programs could use if they don't have them currently to be able to monitor the supply of Bicillin and where it's located. So as I said, Roxanne and I have really been meeting almost weekly for about a year, really talking about how do we develop this tool and what are the needs for programs around Bicillin. So we've been having these weekly discussions. We also conducted a survey in late November and December for all the 65 funded project areas, as well as the U.S. affiliated Pacific Islands, to be able to figure out what programs have computer systems and what are your needs around forecasting. So we've, over the past year, primarily CDC developed it along with some consultation with NCSD, as well as the NCSD Program Committee, which is comprised of people working in the field, to take a look at this tool to make sure that it's, easy to use and feasible. And then we've also spent some time looking again at, are there systems that are already out there to help programs to be able to monitor their, for programs that don't already have systems, are there some things that programs could use to monitor their Bicillin supply and where it's located? And then lastly, to provide technical assistance to programs around forecasting and any issues around Bicillin. So I'm going to quickly go through the results of our survey. So again, we did the survey from September through November of last year. Had a really good response rate. About 83% of project areas did get back to us. Some interesting findings. About half of the project areas indicated that they don't, over half, a little bit over half, indicated they don't have a centralized computer system, whether a web-based system or even a spreadsheet system, to be able to monitor their Bicillin inventory. Now, some programs have 3 or 4 large jurisdictions, and those jurisdictions, in lieu of the project area monitoring it, they monitor it and then probably report to the project area. But at least, so that indicates that over probably 30% of project areas need some kind of a system to be able to monitor their inventory about it, what's how much do they have on hand, as well as where it's located. Interestingly enough, over half of the project areas indicated they don't have written policies or procedures regarding Bicillin inventory. So one of the things that we hope today is that NCSD will be happy to be a clearinghouse if people would like to share their written policies and procedures with us. We can make those available to your colleagues who don't have a copy, and they can maybe take those instead of reinventing the wheel, adapt what you've already developed and adapt it. Or perhaps you've created a procedure and you want to see what other people have included. So at the end of the webinar, you'll have my email address. We'd love to get copies of people's policies and procedures regarding Bicillin inventory, or even if it's broader as far as your system to monitor your medication forecasting system. So again, feel free to share those with us at some point, because I think they might be helpful for your colleagues. A few other things that we learned. Over almost 3/4 of you indicated that you're interested in learning what systems are available to help monitor your inventory and distribution of Bicillin, and potentially even dispensing of Bicillin. So there's obviously a big interest, and almost 80% of people indicated that they would like to see about any kind of tools that programs could use to really help them estimate how much Bicillin they need, sort of an evidence-based tool, instead of just saying, well, we ordered 200 vials this year, let's jump it up to 250. We wanted to come up with a tool using a little bit more evidence-based reasoning on that. So if I don't see any questions, I'm going to turn it over to Roxanne, who's going to give us an update on penicillin G availability. Roxanne?
Okay, thank you, Charlie. Okay, so for this portion of the webinar, we'll provide a brief overview of the current availability of the 2 penicillin G products used for STD management. If you have any questions regarding the information that I'm going to present, please jot it down and we can address those questions after I finish this section, and also during the question and answer period if time allows. So as a brief review, penicillin G, benzathine, Bicillin L-A is the recommended treatment for syphilis and the only recommended treatment for pregnant women infected or exposed to syphilis. Pfizer is the sole manufacturer of Bicillin L-A in the U.S., and as many of you are quite aware, Pfizer experienced a protracted manufacturing delay of Bicillin L-A from 2016 through 2017. However, Pfizer officially resolved the Bicillin L-A shortage as of May 8, 2018, and now Bicillin L-A is currently available without any allocations. So we will continue to work with FDA drug shortage staff and Pfizer to monitor the Bicillin supply. Programs should contact their prevention specialist project officer or send an email to the std_apps@cdc.gov mailbox to report any challenges with securing the Bicillin L-A supplies. And we plan to send an updated Dear Colleague letter to the programs within the coming weeks. So let's move on to the penicillin G procaine. As a review, it's one of the recommended treatments for congenital syphilis and an alternative treatment for both neurosyphilis and ocular syphilis. Pfizer is also the sole manufacturer of penicillin G procaine in the U.S., and the penicillin G procaine is currently still unavailable, so there is no stock currently on hand. Pfizer is continuing to prioritize the production of Bicillin L-A, so it's delayed the release of the procaine penicillin, but the expected delivery date for the procaine is late 2018. So we'll keep you posted on any updates we receive, but until then, you can look at our guidance on our webpage for any recommended management modifications. As with the Bicillin L-A, CDC will continue to work with the FDA drug shortage staff and Pfizer to monitor supply. So I will stop there and see if anyone has any questions before we move on to the next section of the webinar.
So again, if you have any questions, feel free to put them in the question and chat window. While we're waiting for questions, I know we've had people join us after the webinar started, so just as a quick reminder, you can download a copy of today's slides as well as the tool that we're going to talk about next right now by using that select file and use window next to the right of the slides and select the file and then hit download, and you can download those right now. We will also be posting those on the NCSD website probably within the next week. So we'll put an item in our NCSD Weekly that goes out on Friday and let you know when it's available. But again, just because people have joined us late. So I'm not seeing any questions, Roxanne. I guess we should move on.
Okay, thank you.
Great. And again, if anybody has questions and we get started in the next section, we'll have a pause and be able to take them a little bit later. So let me just go back for a second. So one of the things that we recognized that there was sort of a need in the field was, can we come up with some kind of a easy-to-use tool that people could use to better forecast how much Bicillin they needed, sort of based on some recent morbidity data, as well as give people the ability to even use some more variables if they wanted to. So, again, it's important because we want people to have enough stock on hand, so if we ever come to a point where there's a huge outbreak or there's shortages, people know where their Bicillin is, and they have hopefully enough on hand to be able to kind of handle those kinds of situations. So the spreadsheet that we're going to show next was primarily developed by CDC staff, again, in consultation with NCSD, and we did have people out in the field actually test it to make sure that it was easy to use and answer your questions. So I know this is kind of hard to see, and I'm going to actually hopefully try to show you live what it looks like. But this is what the spreadsheet looks like, and maybe a little bit better picture is, without the notes, is this is sort of what the sheet is. So I'm going to take a second now, if it works, and try to actually open up the sheet live here. Just bear with me for a second. So this is what the spreadsheet looks like, and there's two types of cells. The yellow cells are optional. So one of the things we wanted to do is, we know that some programs, the basic information that they have is how many reported cases that they had in a given year. So if that's all you have, the only data that you have, you are able to put that in. For example, I'll just kind of show you. So let's say you had 200 cases in 2016, and now you've had an increase, and now you have 300, and based on just on that alone, it tells you how much Bicillin you would need to order in 2018 or 2019. And so you put in the number of cases that you had for the various stages of syphilis as well as congenital syphilis. And this is, the mothers are going to go under their, primary and secondary, early, late, and or late. And the, the infants are going to go under the congenital cases. So at a minimum, if you just fill in the green, you'll be able to estimate your Bicillin needs. For programs that have access to more data, like the number of patients that they epi-treat per case identified, you can actually put that in, for example, in here. So let's say it was, somebody has a really good DIS staff and they're able to identify a lot of partners. You can actually refine the data. The same thing is if you know what percentage of your cases are treated with non-Bicillin drugs, or, so you're able to put that in there. Or, for example, if you know that your program only provides 60% of the Bicillin and the rest is provided by private providers, then that helps you. Instead of having, let's say there were 200 reported cases, but your program only provided Bicillin for 160, this is going to help you refine that, that calculation, so you're not having to purchase Bicillin and forecast Bicillin for the cases that are where the Bicillin is provided by other kind of providers. So this is what the spreadsheet looks like. There are a number of footnotes, and we really try to make it very explicit on what each of the items meant. So, what are reported cases for the purpose of this, and how these different things work. So the notes are very detailed, and then along with the notes, there's, I think it's a 3 or 4 page really detailed guide on how to use the spreadsheet. So again, we've made the tool available during the webinar that you can download. It's also going to be made available. We may refine it later based on your comments. So if you start using it and you find some issues or you have questions, you can email myself or Roxanne, and again, our email will be available, or whoever your program consultant is, and we will get feedback. And so hopefully this tool is, we think it's very simple to use, and I think it's going to really help programs have a little bit more evidence-based system to estimate their Bicillin. So let me open it up for questions for a minute. Any questions on the tool? And again, while you're waiting, you can download a copy of this tool right now by hitting that Select File button. I know I must sound like a broken record, but I want to really make sure that, again, people have joined us throughout the webinar. But so you can actually download that now and start using it immediately after the webinar. And again, if you have any questions on how to use it, feel free to email me or Roxanne afterwards. So I'm not seeing any questions regarding the tool, and if you think of something, again, feel free to put a question in the chat box, and we will get to it. So we did have a question from one colleague that what we found was the last shortage was that the private providers needed Bicillin, but if we don't forecast for them, how do we help them? Well, one of the things is that the way the tool works is you put in the total number of cases for your jurisdiction. So you could that's the most Bicillin that you would potentially need. So I think by using those numbers, again, or you could even add a little bit if you really wanted to be safe. That's going to give you more, because we actually, it's not just one dose per use. There's some factors in there in the formulas that sort of figure, like for every case, there might be like 10% more, or 20% more. I'd have to go back and look at the actual formula. So that will really help your jurisdiction know how much total Bicillin you might need for the whole jurisdiction versus what you might need only for what you purchase. So I'm not sure if that answers the question. I think that hopefully will, or I think you could actually, let's say you had a high volume provider that treats 50 or 60 cases a year. You could actually give them this tool or get the numbers from them and actually do the calculation for them. Second question was, is it possible to type data into the gray boxes on the tool? I don't believe so. I think it's been locked down. I'd have to, but I might be wrong, so I have to go test it. If that's the case and you find that, we can go back and lock the tool down. I mean, we've tried to make it, I believe the tool is locked down so that people can't go in and change the formulas, so somebody accidentally changes something, those kinds of things. So again, I think the only places you should be able to enter data are the green or yellow fields. Okay, so I'm not seeing any more questions.
Charlie, this is Roxanne. I just did want to add that we are planning to update the instructions for the tool to be used in future years. So the dates that are reflected there now were just for 2018 and 19 projections, but we'll have instructions for how to make those changes for the future.
Great. Okay, so the next section we want to talk about is sort of what tools are available out there to track inventory, both quantity as far as where it's located. And we've been looking at this for a while. And so one of the things that we had sort of developed, or we had looked at fairly early on was that CDC had developed some tools primarily in response to emergency preparedness, disaster kind of work, those kinds of things, to provide, local health departments and local organizations some tools where they could keep track of supplies that they were handing out and those kinds of things. And we looked at that and said, perhaps this might be adaptable for medications. They already were doing it for medication. We thought maybe we could use it for Bicillin, perhaps other STD medications. So we're going to have our colleagues at C-Cells in a minute show you sort of one example of a tool. And the other thing is that CDC, in consultation with NCSD, will be thinking about what are other tools that people might need. So we're not saying that the tool we're going to show you in a minute is going to work for everybody. A lot of you, or at least half of you, already indicated that you already have a system that might be working. And if your system's working and getting you all the information you need, there's no need to develop a new system unless you see something that you like. We also recognize that there's a wide variety of programs as far as size and resources. So for some, jurisdictions that have low morbidity and have low funding, you may only need a simple spreadsheet or some other tool. And so if you find that the tool we're going to show today may not be useful, we are going to be working over the next period of time to help develop other tools. And we also encourage, if people locally have developed some tools that you find are very useful for you and you think are adaptable or shareable to other jurisdictions, please let us know, and we will, again, NCSD especially can help foster that through our peer-to-peer technical assistance program and getting those tools out to people. So there's no sense in reinventing the wheel. Let's share what we've developed at the local level. So I'm going to turn it over to Susan Hughes, who's going to talk about the countermeasures tracking system. So Susan?
Hi, thank you, Charlie. And good afternoon again, everybody. So I'm going to talk a little bit about one of the systems that is part of the countermeasure tracking systems. And that system is called the Inventory Management and Tracking System, or IMATS. It is a full-blown warehouse management system that is used to track medical countermeasure inventory. We collect data such as product information as far as like the strength, the dose, manufacturer, NDCs, storage facility information anywhere this inventory is housed, on-hand inventory, shipped inventory, what's been dispensed at an inventory level, as well as state and local user information. As far as the public health benefits, it allows us to easily monitor and report inventory statuses, or allows our users to do that. And it also helps to identify their points of dispensing facilities where products is shipped at the endpoint for dispensing. What I'm going to do is I've actually taken some screenshots. So I'm going to show you a handful of our processes so you can get an idea of what the system looks like and what type of functions are available in the system. First of all, when any user that logs into IMATS will land on the dashboard here. And the dashboard basically shows four main inventory functions, basically what you're expecting in. And when I say what you're expecting in, you is basically any organization, location where you store inventory that you need oversight of. So assuming that's a warehouse is where this would come into play, our Create Receipts tab is basically everything due into your facility, everything you're expecting. Put away, it's a warehouse function, basically a movement function from a receiving area to a set storage space. This may not be applicable to a lot of storage areas, warehouses, but it is available in IMATS. Pick and ship, of course, is any items you need to ship to one of your customers, or maybe from a state to a local health department. Next function I raised to talk about a facility. A facility in IMATS could be anything from a large warehouse or distribution site to basically a storeroom. Again, any place that you have your Bicillin or any other products that you need oversight of or you want to track. This facility page you see is a typical ad page in IMATS. We indicate all required fields with a red asterisk. All other fields will be, of course, non-mandatory. And again, any place you store inventory or need to ship inventory to, you would set up as a facility in IMATS. As far as adding your inventory, like even if you didn't really need a full warehouse system, you can still track inventory in IMATS at that facility level. Again, your pharmaceutical products, it comes pre-populated, anything in the Orange Book in IMATS. You can configure your own products, any non-pharma products you want. Pharmaceuticals, of course, you see we will require your lots and expiration dates, and as well as other information. We have funding source types, which is where we don't track unit price anywhere in IMATS, just where the resources came from that allows you to purchase these products. You can also, there's a secondary field funding source where you can configure it if you need to divvy up that funding on another level. This shows you a search inventory page, which will allow you to do a quick search of all inventory in IMATS for your assigned facilities. In IMATS, there are a couple roles, and one is a state-level role. So if you're an individual who needs oversight of your entire state, if you have that role and you come to the search inventory page, it's a quick way to see the entire inventory within your state that's housed in IMATS. Dispense inventory, it accounts for dispensing at the inventory level. It does not account for it at the patient level, but it allows you to track when your inventory has been dispensed to a patient and consumed. This is under the main inventory management window. We also have a report, one of our inventory report. There's an option where you can include this dispensed information along with the on-hand inventory counts. I believe that is our, okay, as far as IMATS implementation, I know Charlie spoke about, free version of IMATS. Basically, we call it IMATS Connect. It's a locally deployable version at IMATS of IMATS, our system. Your jurisdiction is responsible for security and access, so user management, and how you choose to implement it may require additional IT support. You can, as an individual user, you can install it on your local laptop, but if you want to host it on a server, of course, that's going to require more IT resources and hardware. But IMATS Connect would be the version that would be available to you. And if you are interested in IMATS, and this will be in your downloaded copy of the things, you can contact ctshelp@cdc.gov and they can get that process started.
Okay, great. Thank you, Susan. Okay, thank you, Susan. So, again, the IMATS, the Connect version is sort of the basic system that if you're a small health department and you have like maybe one facility or two facilities, that might really work for you because you could deploy it locally. You do have the ability to scale up. However, you're going to probably have to use some of your own program resources to work with your IT people to get it on the network and make it deployable across the jurisdiction. So, this kind of gives people a range. At least we want to have something minimum. And I think, again, as I said before, CDC and us we are going to look at what other tools, from the simplest to more complex, but especially simple tools that are available that people might have. And again, we encourage, and this might be a good time now, if people have already developed a really good spreadsheet tool that they think is deployable or helpful for a jurisdiction, if you could either raise your hand and let us know, and we can maybe unmute your phone, you can talk about it, or we can get a hold of you later. So if you have any questions for Susan, Roxanne, or I right now regarding either tools that are available to track inventory or questions regarding the forecasting tool we talked about before, let us know, and we'll just wait a minute and see what kind of questions we get coming in.
I see, Charlie, I see a question about IMATS. IMATS, there is a way to upload information. We have import function under setup that it will allow you to quickly add your inventory. You can also import facilities and whatnot. So there is a way, so not everything needs to be added manually.
Okay, and we just got a question. We already have an access database for all meds, including Bicillin. Do we need to install IMATS? Well, first of all, we're not saying anybody has to, these systems are optional, but we're telling people there are tools available. If you already have an access database and it meets all your needs, then continue to use it. And in fact, if you think it's deployable and maybe usable for other people and would be willing to share it, again, if you could email me or Roxanne, send us a copy of the database or we can be in contact with you. We'd be happy to share successful, easily deployable systems with other people. I think that would really help a lot of the project areas, especially the smaller ones that don't have a lot of resources or have, IT technical staff on hand to be able to develop those systems. So again, that was one of the purposes of this webinar, is to really use the collective wisdom of everybody in all the project areas and be able to share what resources are out there.
And Charlie, this is Roxanne. I just wanted to add for clarification. According to the new NOFO 19-1901, there is a requirement to monitor the inventory, but we're not suggesting that you have to use the IMATS system. So I just wanted to clarify that.
And so I believe Rebecca Stanton has a question. Let me see if I can find you. You may have called in. I don't see your number. I would just say at this point, just what I maybe can try to do is unmute the phones. I think we're ready for some questions and discussion. Again, I would ask everybody to make sure your phone is on mute. I'm going to, in fact, I just found this one, so hold on for a second.
So Charlie, there's another question for the IMATS team, and it's asking, does the IMATS have the ability to export data to other systems or to integrate with an electronic medical record?
Hi, Roxanne. I'll take that. The IMATS Connect that you'll be deployed locally is standalone. It won't be integrating with any other systems. What you'll be installing, but there are ways to export data from the system. However, you'd still have to find a way to get that information to your other systems.
Okay, Rebecca, we've unmuted your phone, so if you want to, feel free to speak up.
Hi all, thank you. This actually is less of a question and more of a comment from what we've experienced monitoring Bicillin during the last shortage. We actually did have an outbreak in a jurisdiction that was not 340B covered, and so normally what we would do is lean on some of our other jurisdictions to provide them with additional Bicillin, and that kind of really limited our options because our largest jurisdiction is 340B covered, so we couldn't just give them the meds. So as folks are developing their Bicillin monitoring plans, knowing which jurisdictions use 340B meds might be something you want to consider building into your protocols.
Thank you for that. Any comments on that, Roxanne, or issues related to that?
No, Charlie, I don't have anything to add. That was really good information to share.
Other questions that people might have, and we'll leave it open for about 5 more minutes for discussion. So Tamara wants us, can you please repeat this info about 340B?
Hi. So the situation that we were under is we had an outbreak in a jurisdiction and they ran out of Bicillin. And because 340B has some pretty strict regulations on how their supply can be monitored, normally what the person who's administering the Bicillin has to have, they have to be the one who performed the test. And because the jurisdictions were very geographically sparse, we couldn't just send the cases that were found in that one area all the way to a clinic with 340B drugs, nor could we give the 340B drugs from our clinic that had supply available directly to the person who was experiencing a shortage. So knowing which of your jurisdictions have 340B covered drugs may be important as you're making decisions in response to areas that are undergoing a shortage. That was just our experience. Others may have ideas for ways around that, but we were advised by 340B to not just give the doses to that entity since they weren't covered.
Great, thank you for that information. Okay, last chance, any other questions right now? And hopefully we'll, at the end, we'll leave it open again if anybody thinks of any questions. So I'm going to turn over to Roxanne, and we're going to sort of talk about what are some next steps.
Okay, thanks, Charlie. So just as a reminder, the webinar recording and slides along with the projection tool and the accompanying user guide will be available on the NCSD website in about a week's time. But while you're on the webinar, you're free to download the slides and also the tool with the instructions. If you could, with a copy to Charlie, please contact CSELS at ctshelp@cdc.gov for any assistance with the IMATS database that was presented today. Also, please contact Charlie at his email contact information, which we'll have at the end of the presentation, with any examples of monitoring inventory tools and resources or the written policies and procedures for monitoring inventory. Our plan is to compile this information and share it with you guys in the STD programs. And if you have any questions to us in the Division of STD Prevention regarding the NOFO 19-1901, please send them to our email address, std_pchd@cdc.gov. So I'll turn it over to Charlie for the last poll question.
Okay, thank you. And we'll have a couple more minutes for questions and discussion if we need in a minute. So we want to know if today's webinar was worth your time in attending. Hopefully it was, and if it's not, send us an email and tell us what we could have done better, or what information that we didn't provide that you need to be able to help with your program. We'll leave the poll up open for about 10 more seconds. So it looks like most of you who answered the poll thought some of the information was helpful, and we're glad to hear that. I think you're going to find the Bicillin estimating tool should be very helpful, and I think, again, if you are in need of a data system, either the IMATS Connect system, or let us know and we can think about what other systems might be available. So I know we have about 10 more minutes remaining. I'm going to leave the screen open so people, again, if you haven't already, feel free to download the slides, the Bicillin estimator tool, or the instructions. And then if anybody has any questions, either write it in the chat box or raise your hand, and we might be able to take your phone off mute and have a discussion. If there's information people feel they need around Bicillin they don't have and need, we'd also like to hear about that. So we'll leave it open for about 2 or 3 more minutes to see if we get any questions. Again, on behalf of NCSD, we really appreciate everybody taking time out of your busy schedules to participate in the webinar. Contact information for myself as well as Roxanne is here. And we would also like to acknowledge the help we received from Jennifer Fold, Tom Gift, Harold Chesson, especially in their development of the tool, and that's where the credit should go. Our colleagues at CDC CSELS for sharing their information about the IMAT Connect tool, and for NCSD in helping to sponsor this webinar and providing technical assistance and capacity building to people out in the STD prevention field. So again, we really hope today's webinar was worthwhile. We'll leave it open for about 2 more minutes for any questions. And if not, we hope everybody has a great afternoon, and good luck in writing your applications. I see we have one raised hand. Rebecca, I think you have a question or you want to make a comment?
No further comments. I think I just forgot to unraise my hand. Thank you.
Okay, well, I'm hearing no other questions. I'm going to give everybody 10 minutes extra. And again, we really appreciate everybody taking the time to attend, and look forward to, again, the materials we posted up on the NCSD website in about a week. Thank you.